I'm aware of two trials, and one of them is in patients with Alzheimer's disease, and this is in also mild cognitive impairment. So this is a sort of a preamble to Alzheimer's disease, and this is an approach that Dr. Mark Tuschinski and myself been working at University of California system for almost 15 years or so. And this involves delivery of adeno-associated viral vector, which is a gene therapy approach, into part of the brain that is called the entorhinal cortex. And this is part of the brain that degenerates in patients with this type of dementia. This is meant to deliver a trophic factor that will increase the innervation in this part of the brain, specifically in the hippocampus, and then all the projections from the hippocampus into the cortex. So our hope is that by the delivery locally to that part of the brain using MR-guided gene delivery technology, we'll be able to jumpstart again the activity within the hippocampus. Specifically, we hope for increase in the stem cells that reside in the hippocampus to become more and more functional. The beauty of gene therapy approach is using the technology that we developed is that we can, with the use of magnetic resonance imaging, we can place the gene therapy specifically only in the part of the brain that we're targeting, without any spillover to other parts of the brain that may cause some adverse events. So that is exactly what's being done in these patients. We're treating 12 of those patients right now. We have, I believe as of today, 2 more patients to go to complete this trial. It is done at University of California, San Diego, and also at the Ohio State University. So it's an academic trial. So that is a great promise, we hope, to the community when it comes to Alzheimer's disease. There's another trial that is ongoing in Europe and also in the States, and this is meant to target patients with the genetic form of the frontotemporal dementia. Progranulin 1 is where the mutation takes place. So these patients are being identified by genotyping. And the innovation here has to do with some of the work that we've done quite some time ago, showing that if we deliver the viral vectors into the part of the brain called thalamus, it undergoes axonal transport, a very specific axonal transport to the cortex, and depending which part of the thalamus is being targeted, one can alter these axonal projections to specific cortical regions. So this is exactly how this trial is being conducted, by the delivery of the AAV that carries a gene for the progranulin 1 into the thalamus, and that allows the axonal transport to spread the therapeutic gene throughout the cortex. Obviously, temporal cortex it's the main target here. But as you can imagine, we cannot locally deliver to multiple cortical regions because that would involve just too many needle passes, and in this case, we just do one, and then let the projection do the rest. So a very exciting trial, and we'll be watching very carefully and at great interest what kind of outcomes are in patients. It's a fast-progressing disease, of course, so you know, I hope that safety and some of the early efficacy will be identified soon.